afternoon, everyone, and welcome to a new year and to a new season. This is our fourth season for the Stop COVID Deaths webinar series. I'm Dr. Raymond Francis Sarmiento. Today, as you may have seen in our posters and email invites, the topic for today is, are you afraid of COVID-19 mutations and variants? And thank you again for continuing to join us in this learning journey. This is our webinar number 36. That will indicate that we have been in this situation for the past 9 months, and hopefully all of the lessons that we have learned in this past few months, we continue to apply them as we continue our fight against COVID-19. And as always, maligong bagong taon po sa inyong lahat. We have with me my mentor and my partner in crime, the Special Envoy for Global Health Initiatives, Dr. Susie Pineda Mercado, as my co-host. Dr. Susie?
Hello, Raymond. Happy New Year and Happy New Year, everyone. I'd like to greet all of those who are watching us live, who have joined us here in the webinar, and also those who are watching on the playback through TVUP. So Happy New Year to you all. Thank you for sharing your wishes for 2021. I think we all want to start the year with hope, and many of you really want this pandemic to end. We want the vaccines to be available. And I just like to say that we've got so many people from all over the country, Raymond, Las Piñas, San Carlos City, Quezon City, Bulacan Medical Center, Binyan Medical Society in Laguna, Pangutaran, Sulu, Negros Occidental, Imus, Cavite. Ang dami po all over the country. 13 Martires in Cavite. We also have people are watching us from Romblon, from Dinagat Islands, actually from Guam. We also have Mariveles District Hospital in Bataan. So we'll continue to just acknowledge all of those who are here, but welcome. And I know you're really eager to learn more about the variant strain, and it has already been documented in the Philippines, but should we be afraid? I think throughout this webinar, we have been talking about us being empowered to be able to serve and to cope. So if you're afraid, I hope you won't be afraid after, or at least if you have more information, then we will know what we can do to help everyone. So good morning, good afternoon, good evening to everyone. Raymond, over to you.
Thank you, Dr. Susie. And before we get the ball rolling and have our experts who will be discussing it both from a clinical and also from a public health perspective, mostly from a public health perspective, the COVID-19 mutations and variants. Just to let you know, and for those who are joining us for the very first time, the sequence of our program for today, there will be an opening remarks, and then moving on to our discussants and our reactors, and then finally a panel discussion, Q&A exchange with the questions also being entertained from the audience afterwards. So, but before we proceed, let me take this opportunity to acknowledge the very hardworking team behind the Stop COVID Deaths webinar series. Thank you so much to the University of the Philippines System, UP Manila, UP National Telehealth Center, UP NIH. We also will not be here without the technical support of the UP Information Technology and Development Center, ITDC. For those who are joining us naman po, baka mas madali po sa kanila joining us through YouTube or maybe in Facebook. Those who are joining us in YouTube po, alam nyo po na kayo po ay naka-join through the YouTube channel of the Internet Television Network of the University of Philippines, which is TVUP. So maraming salamat po. We'd also like to thank our special partner for this webinar, the UP Manila College of Public Health, and also the UP Philippine General Hospital, and everyone really who has been helping us make this learning series possible. Over to you, Dr. Susie.
Well, Raymond, I can't believe it. This is webinar number 36 for 36 weeks. Well, we had a little bit of a break at Christmas, but it's the 36th webinar, and we are committed to continue to do this, to bring information to you. And I'd like to say a special welcome to the members of the media who are here. So we've opened open the webinar. In fact, we can take 3,000 participants for all of the webinars now. And, we actually prepared for grand rounds for this day. But when we regrouped in January, we said, we need to talk about this variant because it's so relevant and people need to know more about it. So I'd also like to thank all our guests and in particular the UP College of Public Health for, on a short notice, being willing to co-host and gather everyone who could be here today. So maraming salamat po sa inyo. And so I think while these topics are hot, we're going to continue to have special topics and revert to the grand rounds format after we have talked about a lot of things. So we're going to be talking about vaccination also next week. Over to you, Raymond. I think people will still want to know about your certificates of attendance.
Thank you, Dr. Susie. For those who are joining us for the first time and for those who continue to send us messages directly and email us, maybe sending us messages through our Facebook account. Yes, the answer is we do provide electronic certificates po. Those are signed e-certificates by our, let's say, by our team at the University of the Philippines system, but only those who have spent at least 50% of the webinar duration dito po sa Zoom will be the ones who will be provided both a copy of their electronic certificate and also a copy of the presentations po of our esteemed panel of speakers. And for those who are asking, yes, all of our previous 35 episodes at pagkatapos po nitong episode na to ay ilalagay din po siya sa YouTube channel ng TVUP. So all 36 webinars and counting, yung future po nating mga webinars will be found and may be found in the YouTube channel of TVUP. So without further ado, I think let's take this opportunity to Dr. Susie will introduce po our opening remarks speaker for today.
Great. Thank you very much, Raymond. And I am delighted, honored to welcome our special guest who, on very short notice, helped organize all the speakers. He is a leading figure in public health now in the Philippines, none other than the Dean of the UP College of Public Health and Center Director at the CMEO TropMed Regional Center for Public Health, Hospital Administration, Environmental and Occupational Health, Dr. Vicente Belisario. June, welcome to the webinar.
Magandang hapon, Susie and Raymond and all the viewers.
Oh, salamat naman. Thank you. Thank you for joining us and for helping whip up the format for today. Without you, we could not have gotten all our speakers. But June, I know that you're doing alam niyo po, to si Dr. Belisario ay matagal nang kilalang dalubhasa po sa public health to. And he was also working with the World Health Organization. We were there at the same time. But currently, he is the Center Director of the Southeast Asian Ministers of Education Tropical Medicine Regional Center at the UP College of Public Health. And so, June, I wanted to know, do you get to talk to the other deans of the colleges of public health in the region? And what are they saying? What do you see as the scenario for 2021?
Thanks for the question, Susie. Yes, it's and thanks again for this opportunity to share also about CPH and this co-organizing of the program this afternoon. College of Public Health is Regional Center for Public Health, and what that means is we are a public health training center in Southeast Asia. CMEO stands for Southeast Asia Ministers of Education Organization. And then there is a subgroup called TropMed composed of Thailand, Malaysia, Philippines, which are health directed, and we are a center for public health. Thailand is in tropical medicine, whereas Malaysia is in applied parasitology and entomology, tropical medicine as well. Yes, we get to talk to the deans and directors in Southeast Asia through our other bigger network, which is the Asia Pacific Academic Consortium of Public Health, Susie and Raymond. And in fact, a couple of weeks ago, just before Christmas, they brought us all together and we talked to the deans and we shared our major challenge really is continuing teaching, training continuing research in terms of generation of new knowledge for policy formulation in light of COVID, no, and the new normal. So COVID has changed so many things in major ways in the academe. And this forum allows us to share our good practices. We have learned, no, from some nice practices in Malaysia and Thailand, for that matter.
Mm.
And in fact, one of our one of our interesting things that we shared in that forum is our Master of Public Health Doctors to the Barrios program. We have 160 of them. One of our Doctors to the Barrio students will be around for a reaction part of this forum. Interrupted, disrupted, but we continued in the remote learning sense. And in fact, they're up to finishing their course later this month, and hopefully they will graduate after January. No? So continuing public health education, no, in COVID, in the light of the new normal, is a major challenge for academic institutions. And we do have a role to play, Susie and Raymond, no? Because we have to train the younger ones. We have to
Yeah.
prepare them to meet the challenges of the day, including now COVID and the new normal. Let's also think about the unfinished business of other public health concerns. You know this, Susie, very well, having come from DOH yourself. The unfinished business of tuberculosis, which kills many more than COVID, but we don't talk about it. No, many more diseases like NCDs. So you're also an advocate and champion in this thing, Susie, which kills many more than COVID. No, and therefore, we'd like to open the possibility of future discussions along this line as well. So yes, in the academe, we have so much to share, with the other deans in the region. The Philippines contributes to these discussions, and we hope to be able to continue to learn more from each other so that we can continue our mandate to serve by way of teaching, training, research for policy formulation. Over, Susie.
Okay, thank you very much, Dean June Belisario. No, please, June, go ahead and give your welcome remarks for our audience today.
Okay, maraming salamat uli at magandang hapon sa lahat. Dr. Pernia and AVP Rica of OVPPA, Chancellor Menchit Padilla, no, our champion here in UP Manila, Dr. Gigi Alfonso, TVUP, Susie and Raymond, our speakers, Issa, Alejandria, and Eva Rojas. You will meet them later on. Of course, our reactors, Dr. JJ, and Ma'am Garcia-Lorenzo, our reactors for this afternoon. Welcome to the 36th webinar, all participants in this series entitled Stop COVID Deaths. Indeed, our first webinar for the new year is very exciting for us in the public health arena, as we will be talking about the very recent developments in COVID, the COVID variants. Every day in the news, not so good news, in fact, but there is very good news. We are not helpless in all this, as there are public health measures to help manage and reduce the risk of getting COVID-19, even with the new variants. The UP College of Public Health, your Semiotrope-Med Regional Center for Public Health, is very pleased to be co-organizer of this first webinar in 2021. Thank you, UP System, UP Manila National Telehealth Center, for connecting us in this major initiative. Public health is about promoting health and preventing infection and disease, along with its complications. Awareness is key, however, to addressing major public health concerns like COVID. Today, we will hear about viruses and mutation, the COVID variants. RNA viruses, we will learn, the etiologic agent of COVID-19, are said to be more likely to mutate. And we'll hear more about this in a short while. We have been hearing about it. According to the WHO, the first case of the new variant was recorded late last year, the last quarter in England. Early December, this was announced, the emergence of the new UK variant. As of late December, this variant has accounted for more than 28% of cases of SARS-CoV-2 infection in England, and the population genetic model suggests that it is spreading more quickly than other lineages. The UK's new and emerging respiratory virus threats advisory group has in fact reported that this new variant had indeed a higher rate of transmission compared to other variants. Just last Wednesday, this is hot in the news, Susie and Raymond, the DOH and the Philippine Genome Center has officially confirmed the detection of the UK variant in the country. Thus, there are a lot of questions about COVID-19 and now the variants. As we anticipate the arrival and rollout of the COVID-19 vaccine, I've been hearing about this every day. No? These days, there emerge the new variants. Are we really losing the battle against COVID-19? Are we dealing with a deadlier virus? Could the new variant affect the efficacy of the COVID-19 COVID-19 vaccine. We will hear more about these concerns from our speakers. Now, first from Dr. Issa Alejandria. What about appropriate public health measures to deal with COVID-19 and the new developments? Will our current prevention and control measures still work? Dr. Eva Rojas, who is a physician with public health training with us here in CPH, will help shed light on these questions. To serve as reactors in this forum, Dr. JJ Garchitorena, one of our shining MPH DTTB students assigned in one of our most underserved areas, will share frontline experience from the Dinagat Islands. Do you know where those islands are, Raymond? Where community transmission is ongoing. While Garcia-Lorenzo of Philippine Association of Patients Organizations will share with us reflections from the point of view of patients in our communities. We do hope that this webinar will try to help enlighten us further on COVID variants and public health measures. And in closing, let us remember that we do have other unfinished business related to other major, sometimes even more major public health concerns indicated in the United Nations Sustainable Development Goals. Lingering tuberculosis, which kills more than COVID-19, our continuing to rise HIV, our neglected infectious diseases of poverty, the emerging NCDs, these are all over the place in the Philippines. We look forward to tying up with UP System TVUP in future undertakings as we share more knowledge and expertise with the rest of the world. As all listen in to our distinguished speakers and reactors, we look forward to hearing from you in our Q&A where your questions may be accommodated. Maraming salamat at isang mapagpahalang araw po sa ating lahat. Susie,
thank you very much. That's Dr. Vicente June Belisario, Dean of the College of Public Health, former Undersecretary of the Department of Health, and the one who helped us organize today's webinar. So Raymond, over to you. I think we have an opinion poll, and I think June will have to leave a little early, but thank you so much. The team really wants to thank you for all your help. Okay, go ahead, Raymond.
Thank you for that inspiring message. As always, one of my mentors, Dean June Belisario. Maraming salamat, sir. For our opinion polls, we have 3 questions right in front of you. I hope that it's being displayed. 4 questions being displayed clearly in front of you. First question, it reads, are you afraid of the COVID-19 variants? So ito po ay plural. Yes or no? So, well, it seems that 3/4 or more, almost 3/4 of our attendees or those who have responded said yes. Number 2 states, are COVID-19 mutations expected? So, okay, so more than 96% have indicated that they understand that COVID-19 mutations po are expected. Number 3, who should be responsible for the control and prevention of COVID-19, including COVID variants? The options are individual, number 2, family, number 3, community, and number 4, all of the above. And then finally, number 4 question, is the COVID-19 vaccine the ultimate solution? So ito po ay medyo leaning towards no, 69% of our respondents. Before we go ahead and introduce po our attendees, and as mentioned also by Dr. Susie, a lot of our participants are not just local but also international. So we have people coming in po from different parts of the country but also internationally. I'll just start off with our international attendees. We have attendees from the National University Health System in Singapore, from the Nang Teng Phong General Hospital, also in Singapore, others from Terengganu, Malaysia, Borneo, Indonesia, and Java in Indonesia, Battambang in Cambodia, the Ministry of Health in Muscat, Oman, Hawali in Kuwait, and Abaha in Saudi Arabia. Oh, marami pala tayong Middle East attendees. So maraming salamat po. I know it's not easy to be because of the time difference, but we appreciate that you're able to join us. We also have those joining from the Abu Dhabi Health Services Company in Abu Dhabi, United Arab Emirates, the Hamad Medical Corporation in Doha, Qatar, and then in the United States, Mission Hospital in Mission Viejo, California, from New Jersey, from Everett, Washington, from Guam, and then further in North America, Niagara Falls, Ontario, Canada. We are also being viewed po in Brecht in Belgium. I hope I'm pronouncing that correctly. And then from Dresden University of Technology in Dresden in Germany. First time po ito. Marami po talagang nakasama po sa atin. And you will note that we are over 1,150 attendees po, excluding our organizers and resource persons. So for those who are still hesitant to join lang po kayo. As mentioned, the 3,000 po ang ating maximum capacity for this webinar. Okay, let's start with our formal discussion and the introduction of our presenters. Dr. Susie?
Okay, thank you very much, Raymond. I'll just add a little more, no? Kasi ang daming nasa chat box. Batac, Ilocos Norte, Antipolo, Rizal, Batangas, Palo, Leyte, MMSU College of Medicine, and Makati City, Las Piñas, Corazon Locsin, Montelibano Memorial Regional Hospital in Bacolod City, Camarines Sur, Sipocot District Hospital. Okay, so thank you everyone for being here, because we get our energy from your participation, and I'm not going to stand between you and our great speakers. So as you know, we have been talking about the mutation, and I think it's time for us to hear from, I would say, the woman of the hour. She's everyone wants to get a piece of her. She's on the media. I think this format, our webinar, gives us a bit of an opportunity for her not just to speak in sound bites, but to explain to us in detail what mutations and variants are and what we are to expect. So it is my honor, my privilege to welcome Professor at the UP College of Medicine, Director of the Institute of Clinical Epidemiology at UP Manila, and of course, currently the President of the Philippine Society for Biology and Infectious Diseases, Dr. Marisa Alejandria. Issa, welcome to the webinar.
Hi, Susie. Thank you, classmate. Happy New Year.
Happy New Year, Issa. Are you able to sleep? Nakakatulog ka pa ba? We see you on television. You're being quoted all over the place. How are you coping with this demand on your expertise? How are you? But you're here. We're so happy you agreed to speak and to be with us. How are you? Are you able to sleep at all?
Mahirap tanggihan, mga kaibigan eh. And yeah, I try to. Yes, I have to maintain my health, and I have to prioritize yung mga calls, no, for interviews. So I have, and then I also try to field members of the society to help out, no, in these challenging pandemic, no, all the information dissemination that we have to do, you know, as infectious disease specialists. So for the country, yon, para sa bansa, we have to really sacrifice. Kasi I also have my other responsibilities. No, I still teach in the university also. So I really have to balance and prioritize.
Well, thank you, Issa. I think that's a message for everyone, and that's why I wanted to ask that question, because for all of those who are serving in the front line, I know you want to do more, you want to serve more, but having a balance is very important, and taking care of ourselves is equally important. Many of you will remember that Issa was on our third webinar. The first time, I think this was sometime in maybe April or May, when we talked about the Solidarity trial, and when we were not so sophisticated in our webinar, Raymond. Issa was our speaker on the WHO Solidarity trial. So she's back. And yeah, Issa, please go ahead and make your presentation.
Okay. So thank you, Susie, and thank you to the organizers, no, for having me here again. And I'm happy to be back. And so for this afternoon, so we'll talk about mutations, no, how the coronavirus mutates, and how these variants occur, and what's the significance, no, of these variants. So, so before I do that, let's just have a review, no, where we are now as far as the pandemic is concerned. So the cases still going up. So we're now in the 90 million mark globally, with almost 2 million deaths, but a case fatality rate of about 2%. Okay. So ang ating top three, or gold, silver, and bronze medalist in terms of cases, US, India, and Brazil. And in Asia, it's Iran that's in the top. And in Southeast Asia, it's now Indonesia. We used to be the top here in Southeast Asia. So it's now Indonesia. And then, so in terms of our number of cases in the country, it's now 492,700, and we have 9,000 plus deaths, for a 2% case fatality rate also. And then in terms of the breakdown of the cases, it's still majority are mild, so 85%, and about 5.5% are in the critical, and 3% in the severe stage, and then 6% asymptomatic. And this is our epidemic curve. If you can see, hopefully it continues to go down. So it continues to plateau here. Although here, we'll see some creeping up of the number of cases. So ito yung binabantayan natin because of the holidays. So not all the labs were functional, especially during the holidays. And then we observe also that our patients do not want to go to the hospital during the holidays. So kaya binabantayan natin yan, and then plus the traslasyon, which happened last week. Kaya we extended din yung travel restriction and for another 2 weeks. So hanggang January 31, the travel restriction was also extended kasi we don't want to stress our system for the possible entry of travelers with the variant. So because locally we are trying to monitor also the possible super spreader event from the traslasyon, and hopefully it will not happen. So we'll see over the next 2 weeks. Okay, so that's our situation. Now I'll move now to the coronavirus. How does it mutate and how does it spread? So review lang on coronaviruses. So again, this is an RNA virus. So coronavirus is the family of viruses, and there are 4 genera under coronavirus: the alpha, beta, delta, and gamma. So it's an RNA enveloped virus. And it's the alpha and beta coronavirus which infect humans. And under the beta coronavirus, that's where we have the viruses that cause the common colds, and then yung SARS and MERS-CoV, which cause the severe respiratory syndrome. And then itong ang bago na, itong COVID-19 or SARS-CoV-2. SARS-CoV-2 yung virus, COVID-19 yung sakit. Okay, so yan yung so all these 4 viruses belong to the coronavirus. Yun yung family niya. Okay. Tapos mga anak itong beta, alpha, delta, and gamma. And this picture here shows you the coronavirus genome, okay, or yung genetic profile. So lahat ng living things, every living thing has a genome or genetic profile, which determines our physical appearance, no, and how our body will function. So the same way, ang virus meron din siyang genome, no. So it's a lipid membrane or oily membrane packed with genetic instructions to make millions of copies of itself. The instructions are encoded in 30,000 letters of RNA. Okay. So yun yung genetic sequence or genetic code. Yan, alam nyo yung genes natin, no? Yung adenine, cytosine, guanine, and uracil. Yan yung genes sa RNA, which the infected cell reads and translates into many kinds of virus proteins. Viruses, for them to survive and cause infection, they have to replicate inside the human cell. So when they replicate, yun yung process wherein they follow the genetic instructions, no? So the virus reads, no, the genome and then translates into many kinds of virus proteins. Ito yung mga protein na nasa loob ng virus. Open reading frame protein, spike protein, ito yun. Envelope, membrane, and nucleocapsid proteins that compose the virus. No? These are the structural and non-structural proteins. Okay. And then, so how did we discover, or how did the scientists determine that we have a new coronavirus that has emerged? Okay, so in December, so as you all know, it was a cluster of, or a group of cases of pneumonia presenting as severe cases. No, they had to be ventilated, and then most of them at that time had a history of exposure in the seafood market in Wuhan. But we all know later that it was not just really, it was not just about the exposure to the seafood market. So the patients, they were able to infect their household members who did not have exposure to the seafood market. So the scientists that time sequenced the genome, no, of this new coronavirus, because it was behaving differently. They sequenced it, no, from the the virus that was isolated from the man who worked at the market. Okay, and then they compared the sequence of that isolate with the existing viruses, no, so yung SARS-CoV, MERS-CoV, and that is when they found that it was not exactly the same as the SARS, no? Kaya tinawag siyang SARS-CoV-2 because it's not exactly the same. So about 70% lang yung similarity niya between SARS. And that is the genome. Kaya yun, tinawag na SARS-CoV-2, and it's the first genome that became the baseline for scientists to track the SARS-CoV-2 as it spreads around the world. So yung first genome na yun yung parang basis pag nagsisequence sila ng other viruses, other SARS-CoV-2 viruses from the patients para makita kung saan nanggaling yung infection, kung nagkahawahan ba, no? So yun yung role ng genomic sequencing. So pinapakita kung magkakamag-anak o magkakamuka yung mga virus. Okay. So how does mutation happen? No? Siguro, I'd also like to mention, not just to bring back also yung history of how coronavirus emerged. Actually, it emerged from a mutation. No? They were trying to look at the source, no, and they look at the animals, no, kasi ang coronavirus is found in animals, and they look at bats, pangolins, no, and in the hypothesis is how coronavirus emerged is because of spillover event or mutation, no, from the coronavirus in the bats. Kasi medyo may similarity yung sequence. So nag-mutate yung animal virus and it jumped into man and infecting man. Okay. So actually, doon pa lang may mutation nang nangyari. Okay. So what are mutations? Okay. So a cell infected by a coronavirus will release millions of new viruses, all carrying copies of the original cell, original genome. As I mentioned, di ba, kailangan kasing mag-replicate ang virus for it to survive. So as it replicates, it copies, no, the genome. So in the process of copying, there are mistakes that happen. So parang if you're transcribing, so there are transcription errors. So yung transcription errors na yun yung tinatawag na mutations. And as the coronavirus spread from person to person, nagkakaroon ng random mutations. So mutations are actual changes in the genomic sequence. Okay. So when do mutations matter? So should we be afraid of all mutations? No. So mutations will often change a gene without changing the protein that it encodes. So as I mentioned kanina, di ba, when the virus replicates, it will encode for the proteins, no? And proteins are long chains of amino acids folded into different shapes. Each amino acid is encoded by 3 genetic letters. Ito yung adenine, cytosine, guanine, yung genes. And dun sa third letter, usually nagkakaroon ng mutation, no? And meron tayong tinatawag na silent mutation, which doesn't change the resulting protein, and non-silent mutations, which changes the protein sequence. So, di ba, if you are transcribing or editing, no, kung minsan, pag minor lang yung change, walang effect sa meaning ng sentence, no? Pero pag major yung change, naiiba yung ibig sabihin ng sentence. So ganun din dito sa mutations, no, merong tinatawag na silent at non-silent mutation. So to illustrate, yung silent mutation, so ito yung 3 genetic material, no, yung adenine, cytosine, uracil. Pag nag-mutate siya to ACA or ACC or ACG, yung dulo, no, yun yung naiba, kung the amino acid remains the same, or yung amino acid kasi yung parts ng protein, no? So if the change here does not change the structure of the amino acid, pareho pa rin siya na letter T or threonine, then that's what we call a silent mutation. A non-silent mutation is when the amino acid is changed or substituted into another amino acid. Or kung magkakaroon ng deletion, mawawala yung amino acid because of the silent mutation or the error in transcription. So most of the changes, no, most of these mutations actually have little or no impact on the property of the virus. Right? The impact depends on where the changes are located in the virus genetic material. So saan ba nangyayari yung mutation and anong klaseng mutation yung nagiging effect, no? Anong nagiging effect ng mutation? So as stated here, so depending on where the changes are located in the virus genetic material, they may affect the virus property such as transmission or severity, no? So once that happens, no, yung nagkaroon ng change in the sequence, then that is now what we call a mutation, and that is what we term now as a variant. So viruses with one or more mutations that differ in sequence are called variants. And then, naririnig nyo rin yung term na strain, no? So, interchangeable, pwede siyang interchangeable. So, a variant is a strain when it has a demonstrably different phenotype. So, pag-usapan natin ito mamaya, no? So, it becomes a strain if the resulting mutation results in a difference in antigenicity, transmissibility, or virulence of the virus. So, pag nagkaroon ng functional effect, no? So, hindi lang panglabas na anyo ang nabago, pati yung function, yung sa loob, no, ng virus. Yung function ng virus ay, or yung characteristic ng virus to cause disease ay nagbago din. So yun yung tinatawag na variant. Okay. So why does mutation have to happen? No? So the more viruses circulate, the more they may change. These changes can occasionally result in a virus variant. Yun nga, if it's a nonsilent mutation, no? So that becomes better adapted to the environment compared to the original virus. So the process of changing and selection of successful variants is called virus evolution. So it's a way of surviving, no? Yung the non-silent mutations or the significant mutations is a way of the virus to better adapt to the environment compared to the original virus. Okay. Now, are mutations expected? Okay, so as mentioned, no, so SARS-CoV-2 is an RNA virus and mutations arise naturally as the virus replicates, no, for survival. No? And yes, mutations are expected and it's a natural part of evolution. And in fact, many thousands of mutations have already occurred, but majority of these mutations have no effect on the virus. No? So kaya we don't hear about it, but it's useful as a barcode to monitor outbreaks. So it's when we sequence the virus, no, kahit minor or silent mutation yon, if it's present, then in two isolates from two patients, for example, we're trying to investigate a household that had COVID and whether pareho ng pinanggalingan yung kanilang infection, we do it through sequencing yon. So madidetect siya ng genomic sequencing. So there are thousands of mutations and not all are significant. And in the spike protein, actually 4,000 mutations na rin ang nangyari, no? Okay. So the spike gene mutation is of interest, no? Because if you will review, no, bakit why is the spike protein the one that is being closely monitored, no, in genomic surveillance? Because it's this glycoprotein or these spikes are the ones, no, that facilitate, no, the attachment of the virus to the ACE2 receptors in the respiratory epithelium, no, of our body. So it is the one that facilitates entry of the virus into our body, yung S protein. And ito ring S protein na to, ang major target ng mga neutralizing antibodies. Ito rin ang major antigen that is being used in the vaccines, no, that are being developed. So it is the one that is being targeted by the vaccines. Okay. So of the 4,000, sa ngayon, there are 6 that are non-silent, no, mutations because they have been found to increase transmissibility of the virus SARS-CoV-2. Okay. So yun. So it mas pinafacilitate niya yung entry ng virus into the body. So yun yung so it is this spike gene mutations, no, that is responsible for the increased transmissibility of these variants. Okay. Okay. So now let's go to the evolution of SARS-CoV-2. So actually, the very first variant or mutation was D614G, and it is a substitution of aspartic acid to glycine at position 614 of the spike. And this was first detected in early March, and it began to spread globally, and it became the dominant variant or strain. And this mutation initially appeared to arise independently and then spread across multiple geographic regions. And the researchers, the geneticists, they were studying this mutation, whether it is a natural selection, and they say that it was suggestive of natural selection and an adaptive benefit of D614G. So it's a natural mutation designed for the virus to be able to better adapt into the environment. Okay. However, there are also other data showing that it was also just probably a chance mutation. So there are two opinions, whether it's selective and adaptive mutation versus a chance mutation. But nevertheless, it was the one that really became the dominant strain. Actually, in our country, it was the one that was responsible for the surge that we had in July, August. If you remember, there was one webinar also wherein Dr. Cynthia Saloma of the Philippine Genome Center presented the strains, or the variants that we have, and we were able to isolate D614G in our viral isolates from our patients during this time. Okay. Okay. So now let's go to the different variants that have emerged. So we've talked about D614G, which consists of one mutation. Now let's talk about this B1.1.7 lineage, or the one that you more commonly know as the UK variant. So we're avoiding calling it as UK, kasi nga we don't want to discriminate or stigmatize the way we've also changed the name of SARS-CoV-2, yung nCoV. So it's they call it the variant of concern, and in this variant, the mutation is in the receptor binding domain of the spike protein at position 501, where the amino acid aspargine has been replaced with tyrosine. So this is a nonsilent mutation because the amino acid was changed, and they call this mutation as N501Y. And this variant, in contrast to D614G, wherein isa lang yung mutation niya, there are other mutations together with it, the N501Y. Meron siyang 6970 deletion, which also occurred spontaneously, and it also caused a change in the spike protein. And ang effect niya is has been found to affect the performance of some diagnostic PCR assays that use the S spike or the S gene target. So the PCRs kasi iba-iba yan. So there are PCRs that target the spike nucleocapsid membrane. Merong PCR na spike lang yung tina-target. So pag if it so happened that the one that you're testing has a variant and your PCR is only measuring the spike gene target, it will not detect kasi nag-mutate na eh. So yun yung impact nitong isang mutation na to sa PCR. But most PCRs naman actually have more than one target. I think there are just a few that have one target. And then this is the other mutation, P681H, okay, and a mutation in the open reading frame 8, okay. So yun. So this lineage, the 1.1.7 actually has 17 lineage defining mutations, no, prior to its detection in early September, which suggests that significant amount of prior evolution or mutation has already occurred, no, by the time it was detected. And they hypothesized that it's probably from a patient who was been having a persistent infection, or persistently positive yung kanyang PCR kahit wala ng symptoms. No? So that patient's probably continuously shedding the virus, and as a result, it mutated. Okay, and then in this B1.1.7, 8 of the lineage mutations are in the spike glycoprotein. So as I mentioned, very significant kasi yung role ng spike glycoprotein, no? As it is the one that facilitates entry of the virus into the cell. Okay, so including N501I in the 1Y in the receptor binding domain. Okay, so all of these mutations in the spike glycoprotein are the ones that hypothesized to influence the ACE2 binding and viral replication, and it's the one that is causing the increased transmissibility of this variant. And in fact, the models have shown that it is 56% more transmissible than the original virus, which is why in UK, they say that most of the cases were associated, no, with the occurrence of this variant, the increase in the number of cases. One of their explanation is this variant, although there are also other factors, no, that have to be. So they're not saying that it is the cause, it is just associated with an increase in the number of cases. Okay, and so since it was reported in December, 48 countries have already reported cases of this UK variant, and preliminary epidemiologic indicators suggest that this variant is associated with increased transmissibility, more efficient and rapid transmission. But currently, there is no evidence to suggest that the variant has any impact on the severity of the disease or on vaccine efficacy. Okay, so these are just the list of countries. So mostly in Europe. There are also countries in Asia and the Middle East. Okay, yan. So we've for now we've imposed travel restrictions, no, on these countries. Okay. Now let's talk about the other variant, the B1.351 lineage, or the South African variant. Okay. So this variant also has multiple mutations in the spike protein, including again N501Y, no, which is a mutation in the receptor binding domain. Okay. The difference is that this South African variant does not contain the deletion at 6970, which affects the PCR assay, no? And it emerged independently of the UK variant, first identified in the Nelson Mandela Bay in South Africa back in October, and then was also identified in Zambia in late December, and it appeared to be the predominant variant in the country. And since then, 18 countries, no, to date have reported the South African variant, and mostly it's also the countries that have the UK variant. And again, there is no evidence to suggest that this variant has any impact on disease severity or vaccine efficacy. Okay, so these are just some of the countries, no, where the South African variant was isolated. Now, I just like to discuss this quickly also. This is another variant, the N453Y, and it's related to mink, no? And this was found in Netherlands and Denmark. Okay, so their investigation of an early outbreak in the Netherlands demonstrated a human to mink to mink, and mink to human transmission. So they reported 214 cases of COVID-19 associated with the mink farms, and the sequences from these outbreaks had a this mutation, Y453F, in the receptor binding domain also of the spike protein, which can increase the binding affinity for the mink ACE inhibitor. Okay. And 11 individuals from the Danish outbreak had a variant which termed cluster 5, which had 3 additional mutations in the spike protein. So the deletion in 6970, 1692V, and M1229 naman. Okay, the significance of this mutation though is what is concerning now, because it shows there is continued evolution of the virus in an animal reservoir, which could again potentially lead to spillover events of novel SARS-CoV-2 from mink to humans and other mammals. So the action of the farmers there were to cull the mink to prevent further spread. Okay. And then there's this other variant from Nigeria, okay, wherein they identified 2 SARS-CoV-2 sequences belonging to this lineage, B1.1.207. Okay, it shares one non-synonymous mutation in the spike protein, common with the UK variant, but does not share any of the other 22 unique mutations of the UK variant. Okay. So it is still unknown where this variant may have first emerged. And again, there is no evidence to indicate that this variant has any impact on disease severity or is contributing to increased transmission of SARS-CoV-2 in Nigeria. Okay. Now let's move to the Philippines. So what's the status as far as variants are concerned? So when this UK variant was announced late December, our Philippine Genome Center was mobilized to do genome sequencing of isolates from our travelers. Those travelers with positive PCRs were sequenced, and we also got specimens from hospitalized patients, bank specimens in November and December. So during the first run of the 305 samples that were sequenced, the most common lineage that was found was B1.1.63, B1.1, and 1.1.263. So last week when this was announced, we did not have yet the UK variant. Okay, so and the sample is of course limited. It's just these samples were from NCR, Barrio, and then from a number of travelers. Okay, and as you all know, the press release the other day, we were able now to detect the UK variant from one traveler from Dubai. He's a Filipino resident in Quezon City. He traveled to Dubai on December 27 for business purposes and arrived back in January 7. So when he left the country together with his girlfriend, they were negative. And then when they were swabbed upon arrival, the business traveler was positive for SARS-CoV-2. So he was quarantined, and the results of his genome sequencing was positive for the UK variant, while his girlfriend tested negative. So the necessary quarantine measures were done. So the patient is now isolated in a quarantine facility, and including all the household contacts. And then all the passengers, no, in the flight were also contacted for testing. Okay. I think what's important to highlight here is that this entry of the UK variant, no, it's coming from Dubai. It's actually not in the list, no, of countries that have reported the UK variant. So the detection of a variant, no, the detection of any variant is actually dependent on the capacity of the country to be able to do genomic sequencing. So if your country is not reporting any, it's possible because you're not detecting it. No, you're not doing genomic sequencing, which is what happened with UK. No, so those countries that are doing regular genomic sequencing, they will be able to detect variants. So in our case, we actually commend, no, the Philippine Genome Center. Our surveillance system was strengthened early on so that we were able to pick up this variant, which is not from a country that has been reporting the variant. No? So I think that's important, no, that we were able to detect. So what this means is there is no UK variant in the community that is circulating. So what we have is from a traveler. So that is why we implemented strict quarantine and monitoring to prevent the spread. And we did also contact tracing. No? The whole passengers were contacted. Passengers in the flight were contacted. Okay. So that's the situation in the country as far as the UK variant is concerned. So we have, and surveillance is ongoing, no, for these variants. Okay. So now let's discuss now the implications, no, of these variants. No. So these are questions, no, that scientists, researchers look at or answer, no, in evaluating, no, the importance or significance of these variants. So did the variant achieve prominence through natural selection or chance events? So as I mentioned earlier, the D614G was being debated whether it's just a chance event or a natural selection. And then if the evidence suggests natural selection, which mutations are being selected? And we've discussed that, no? And what is the adaptive benefit of these mutations? Okay, so those that had mutations in the spike glycoprotein, those are the significant mutations which led to increased transmissibility of the virus. Then the next question is, what effect do these mutations have on transmissibility, spread, antigenicity, or virulence? And so far, these variants, based on the studies, have been shown to have increased transmissibility. So the transmission is more efficient, but it does not cause severe disease or virulent or increased virulence. No, it has not made the virus more virulent. Okay, so it does not, again, it does not cause severe disease. Okay. What else? And also most important is that these variants did not change the mode of transmission of the virus. The mode of transmission remains the same through respiratory droplets, no? And then the signs and symptoms also remain the same. So fever, cough, difficulty of breathing, fatigue, loss of appetite, anosmia, dysgeusia. So it's still the same. Okay. So what are the potential consequences of emerging variants? So one, it can spread more quickly in people. So as we have discussed, no, so there's evidence that the D614G conferred increased ability to spread more quickly than the wild type, wild type is the original virus. No? So in the lab, 614G variants propagate more quickly in the human respiratory cells, outcompeting the 614D viruses. So there is also epidemiologic evidence that the 614G variant spreads more quickly than viruses without the mutation. Then variants can also cause either milder or more severe disease in people. So currently, there is no evidence, as I mentioned, that these recently identified SARS-CoV-2 variants cause more severe disease than earlier ones. Okay, it can evade detection by specific diagnostic tests. So I mentioned earlier that there is one mutation, no, that affects the ability of the PCR to detect the virus if it just has one target, no. But if they have multiple targets, then the PCR can still work. It can also potentially decrease susceptibility to therapeutic agents such as the monoclonal antibodies, no, because the action of the monoclonal antibodies is to neutralize, no, to the entry of the virus. So if it's mutated, then the action, this may not work, no, this monoclonal antibody. So because it acts on the spike protein. And then last is it can evade natural or vaccine-induced immunity. So this is the million-dollar question. No? So both vaccination against and natural infection with SARS-CoV-2 produce a polyclonal response that targets several parts of the spike protein. The virus would likely need to accumulate multiple mutations in the spike protein to evade immunity induced by vaccines or by natural infection. So what this means, so far, the vaccines, no, that are that have been developed targets the whole spike protein. So it's unlikely that a single change will make the vaccine less effective. No? So that is what we're hoping. No? Because the mutations are just point mutations. No? It's not the whole protein that has been changed. And the vaccines were designed to target the whole protein. So the scientists are hoping that it will work. But of course, it is being monitored. No? Actually, like there's a preliminary study by BioNTech which produced the Pfizer mRNA vaccine. So they tested the sera of those, the blood, no, of those who have received the vaccine and checked it in the lab, and they found that it still acts, no, it still is able to produce neutralizing antibodies despite the variant. Okay. So over time, though, as more mutations occur, the vaccine may need to be altered. So that's why the behavior of the virus needs to be monitored, and then the vaccine recipients also needs to be monitored. So if we compare this with flu, no, if you are aware, most of you are aware, or all of you are aware, that we need to get injected or vaccinated with flu every year because it mutates every year. And then, so there is a ongoing surveillance, no, and that surveillance will determine what type or how they will adjust the vaccine, no, based on what is the dominant strain of flu that is circulating in the country in the previous year. Yun yung ilalagay nila dun sa vaccine. So we don't know yet if that is how SARS-CoV-2 will evolve, no? Although it has been observed that the SARS-CoV-2 virus does not mutate as quickly as the flu virus. And the vaccines that we have so far prove effective in trials are the vaccines that have so far been proven to be effective in trials are types that can easily be tweaked if necessary. So yun. So in contrast to flu, the SARS-CoV-2 virus does not mutate as quickly, and the vaccines that we have now can easily be adjusted if needed. Okay. Now, the next series of slides are just food for thought. No, these are now for researchers. No, because there's still a lot that we don't know, and we need to do. No, we need to know, such as the mechanisms by which the new variant could become vaccine resistant. So these are research ideas. No, and questions. So if evolution is driven by humoral immunity within infected individuals, vaccine that induce strong cellular immunity may be more resilient. And if the new evolution of new variants is driven by use of convalescent plasma, then changes in how convalescent plasma is used may ameliorate the concern. Then here, no, crowding and not wearing mask may contribute to development of mutations that promote transmissibility. So that's why it is very important that we continue to practice the minimum public health standards. So we need public messaging to preserve vaccine efficacy. And then, is it possible that less effective or suboptimal dosing of the vaccine will accelerate vaccine resistance? We don't know, no? So that those are questions. Now, can we do in vitro detection of new variant resistance to vaccines? So this can be done through serum and cells from vaccinees. No? This can be used in assays that quantify potentially important immune responses versus original and new variants. This requires rapid sharing of sequences and new virus variants. So for those who are basic science researchers, no, could new variants be generated in vitro? How quickly can pseudovirus be generated and shared? Okay, so to do this in vitro research, we need availability of sera, no, or from the vaccine recipients, and it requires consensus on what assay should be done. Okay, and then for clinical detection of new variants resistant to the vaccine, so studies that aim to assess duration of vaccine efficacy may also detect loss of efficacy, not due to strain or variant evolution. So placebo-controlled studies are the ones that are most sensitive in detecting this. Observational studies could potentially detect evolution of vaccine-resistant variants, but would need to be designed with plans for frequent analysis. And then these are other questions. Now, will this happen first for vaccines with lower efficacy? Because as we know, the vaccines have variable efficacy rates. So are the ones with lower efficacies the one that will develop resistance? No? Okay. So these are additional research questions, no, to study the variants, no. So cross-sectional, longitudinal studies, no, to link viral shedding to exposure and outcomes of wild type versus new variants. Can also do a comparative analysis of infectivity and spectrum of the disease of the variants. And then innovative approaches include linking surveillance and sequencing data through AI, artificial intelligence. Then we can do genomic data and reconstruction of transmission chains. We can also study transmission dynamics, virulence, clinical outcomes of the new variants in different age groups. Those with severe COVID and with potential for persistent infections, particularly the high-risk groups and the immunocompromised patient population. Okay. So moving forward, what do we need, no, to have, no, as we monitor the evolution of the behavior of the virus and the outcomes in vaccine recipients, no? So we actually need, I really think we need to have a national COVID-19 integrated registry wherein clinical data, clinical outcomes data, no, from the different health facilities can easily be linked, no, with our epidemiologic surveillance, no. So plus we also need to increase the capacity of our labs to biobank specimens for genomic biosurveillance, for the genomic sequencing, no. So all of these are related. So we need the clinical data, epidemiologic data, and then the genomic sequencing to be able to comprehensively study, monitor the behavior of the evolution of SARS-CoV-2 virus and its impact on the presentation of the disease and its impact on immunity vaccines, or its impact on the action of the vaccines in the vaccine recipients. Okay. So for now, in the country, we've enhanced our genome surveillance, So we're doing genomic sequencing, for travelers from unaffected and affected countries with the variant, So aside from PCR, they get another specimen to be sent to the Philippine Genome Center for genomic sequencing. And then we also are on the lookout for clustering, of cases in households, communities, in health facilities, or in prisons. And then we also get sample specimens from hospitalized patients who are severe and critical, so that we can see if there is an impact on severity. And then also on reinfection. So this, these are priority samples, for sequencing those whom we suspect to have developed reinfection, or those whom we do not know where is the source of infection. And once we roll out the vaccination program, it is important that we are able to sequence, if there are these recipients who develop COVID-19 after being vaccinated, or what we call vaccine failures. We need to look at the sequence of the virus, in these patients or vaccine recipients who develop COVID-19. Okay. So in summary, viruses mutate as part of evolution. The variants of concern have shown increased transmissibility. And just to add that not all mutations are of concern or of significance. And then mode of transmission of symptomatology of COVID-19 remains the same. There is no evidence of increased virulence or severity with the new variants. Minimum public health standards are effective to keep the infections low. So we need to keep the infections low to prevent mutation, to minimize mutation. And most of all, we should not be afraid. We need to keep calm, always counter-check information. Okay. So keep calm, verify the news. Bagong virus variant, pareho pa rin po ang pag-iwas. 4 dapat. So air circulation, avoid crowded areas, or areas with poor ventilation, physical distancing, and always wear face mask and face shield properly. Hindi siya visor or hindi nasa baba yung face mask. And then minimize interaction in crowded areas to less than 30 minutes or 15 minutes. Okay, maraming salamat po.
Thank you so much, Director Alejandria, for that comprehensive po na presentation. If there are any questions from our attendees, please feel free to put them in the chat box or maybe in the Q&A. We already have like 45 questions in our Q&A box, and we hope to be able to address most of them, not all of them po, kasi we only are about 2 hours for this webinar. Next up, we have another presentation, this time from our public health expert po. Please welcome, and let's hear from Associate Professor from the Department of Medical Microbiology at the University of the Philippines, Manila's College of Public Health. She is also the President of the Philippine Hospital Infection Control Society. Magandang hapon po, Dr. Eva Rojas.
Magandang hapon, Director Raymond, and to everyone. So good afternoon po.
Thank you so much, Ma'am Eva. Please go ahead in the interest of time po with your presentation, Dr. Eva.
Okay, so I will share my screen now. And before I start, I would like to thank again the organizers of this Stop COVID Deaths webinar series, for inviting me, and especially through our Dean Belisario of the College of Public Health. It's really my honor to be giving this talk after my mentor. So Dr. Issa is one of my mentors in infectious disease training at PGH. So as said a while ago, I'll be discussing the public health measures in preventing the transmission of COVID-19. So Ma'am Issa discussed the new variant, but I will be discussing the public health measures, both for the original strain or with this new variant. Will it be the same or will it differ? So I will try to answer that with my talk. So to begin with, I want to begin with the this slide showing that still the main mode of transmission. So to date, the main mode of transmission of the disease is via respiratory droplets. So just a background for all of us, respiratory droplets are fluids containing the virus, which are large enough. So its size is around 5 to 10 micrometers in diameter. So it's different from droplet nuclei, which has smaller size. So what's the implication of this size? So since they have somehow large size, they have the tendency to fall on the ground around 6 to 12 feet. And after that, beyond that, it cannot reach areas beyond 6 to 12 feet. So this slide shows, again, still to date, the main mode of transmission is via droplet transmission. So the farthest in ordinary talking, for example, this is an infected person, the farthest that it can reach for respiratory droplet is around 1 to 1.5 meters. But there are studies or even talks before that, how about airborne transmission? So I think several studies have somehow answered this, that yes, this respiratory droplet of the SARS-CoV-2 can be aerosolized, so there will be a chance that it can be transmitted via airborne, but only if you perform these procedures, or what we call as AGP, or the aerosol generating procedures, like when we do CPR, or when we intubate, or when we do invasive procedures like bronchoscopy, then there's a chance that this respiratory droplet can be transmitted via airborne. But still, the main mode is via respiratory droplet. But aside from that, another established, actually more established than the airborne, is the transmission via fomites or inanimate surfaces or objects. So this figure shows that we have here, for example, an infected COVID-19 patient who, after maybe coughing or sneezing, so the respiratory droplets expelled can land on surfaces, and if the surfaces are not properly cleaned and disinfected, and you touch it, and on your part you did not perform hand hygiene, and you touch your eyes, nose, and mouth, because those are the considered portals of entry of the virus to our body, then the virus can also enter our body. So these two are the main modes and established modes of transmission of the virus. So I'm emphasizing the modes of transmission because, as said by Ma'am Issa, even if with the new variant, so far the mode of transmission of SARS coronavirus 2 is the same. So aside from talking about the mode of transmission, so another important thing if we want to have an effective prevention and control measure is to know the high-risk areas, because there are certain conditions or areas wherein getting the disease can be lower as compared to some situations. So WHO released these 3 C's for COVID-19, or 3 high-risk areas for COVID-19. So 3 C's pertain to closed spaces, or staying in closed spaces, or areas with poor ventilation, staying in crowded conditions, and conversing in short distance. So if you have all of these 3 C's, then you have higher risk for COVID-19. So the Department of Health actually released this somehow, how at risk are you for contracting COVID-19? So they say that different conditions or different status categories, you have different risks. Risks. For example, risk of individual. So we all know that elderly, more than 65 years old, and those with comorbidities or living with other individuals, they are at higher risk of getting the disease as compared to less than 65 years old. Also, it will depend on the risk of activity. So if you're in an activity with more people, diba, the higher the chance that you get, or the possibility that you get the virus. That's why we don't promote, or as much as possible, we don't advocate congregation up to this time, diba? So mass gathering. And if you have the ability to maintain physical distance, I've mentioned this a while ago in the mode of transmission, since it's respiratory droplet, so the natural tendency of the virus is to fall on the ground with a short distance. So when you maintain physical distance, then you have higher risk of lesser risk of getting the virus. Also, the duration of the activity. Of course, if you have more time with other people, then the higher the chance also of getting the virus or possibility. Also, the actions and interactions the activity entails, and the venue and environment. So, again, one of the three C's is staying in closed spaces or with poor ventilation. So, studies show that poor ventilation can facilitate the transmission of the virus. So lastly, it also will depend on the risk of locality. So mainly on the epidemiologic situation, or it's equated as the case doubling time. So case doubling time actually is the consideration for the risk of classification of the community and the quarantine measure, or the health system's capacity or the critical care utilizations. For example, here in NCR, we're still until under GCQ, diba? Since June ata, no? Since June up to January, so January 2021, we are still under GCQ, and we have this case doubling time and critical care utilization. So the risk of transmission of the SARS coronavirus 2 might be different in NCR as compared, for example, in Bicol or in other provinces. So it's again very important to know this mode of transmission and this risk, because again, the proper and the most effective prevention and control measures will be more beneficial if it's anchored to these modes of transmission and risk of getting the disease. So this hierarchy of control is actually a generic hierarchy of control, not only for COVID-19, but for other diseases. But somehow, the NIOSH released this hierarchy of control in the context of COVID-19. So as we can see, on top of the hierarchy is actually the elimination, but they say with the current situation, it's somehow really very difficult to eliminate the virus, di ba? Kasi sabi nga nila, unseen enemy si virus. Somehow they tweak it with social isolation. That's why we continue with isolation and quarantine. And then you have the other controls like substitution. And more commonly, we use these engineering controls or the use of barriers, administrative controls. And actually, at the bottom of the hierarchy of control is the use of PPE, which is one of the most commonly utilized prevention and control measures during this time. So what now? So we've heard the lecture of Ma'am Issa. So with all of this news, no, 2 weeks pa lang ng 2021, but we have all of this news. So is COVID-19 upgrading? So do we need to be more afraid at this time with these mutations and with the announcement of the entry of the new variant in our country? Kasi nga, sabi nila, the virus spreads more easily. So it's back up with evidence. So the answer is yes. So studies show that it's 50 to 74% more transmissible. However, Ma'am Issa mentioned this a while ago, walang studies nagsasabi that the mode of transmission of the virus is different. So to date, so the mode of transmission of SARS coronavirus 2 is still the same. So we still have respiratory droplet as the main mode, then aerosols or airborne in some conditions, and with fomites. So with this, ayan, na-flash na to kanina ni Ma'am Issa, the Healthcare Professionals Alliance Against COVID-19 actually released this infographic saying that bagong virus variant, yes, we have this, pero parehong pag-iwas pa rin. Kasi again, the pag-iwas, the prevention is anchored on the mode of transmission of the virus. And since there is no change in the mode of transmission, then we have the same prevention and control measure. So actually, the Department of Health still has these minimum public health measures to preventing the spread of the virus. So bida solusyon, di ba? Bawal ang walang mask, sanitize ang mga kamay, and then maintaining physical distancing, and alamin ang informasyon. So actually, DOH released this 5-point strategy to reduce the COVID-19 related and non-COVID-19 deaths, and under which is there are several strategies to prevent increased cases. So we have increasing the resilience. So under the increasing the resilience, there was a mention of promoting basic respiratory hygiene and cough etiquette. So actually, respiratory and cough etiquette is not a new practice. So this is an old practice, but somehow it's highlighted during this time. So respiratory cough etiquette, whenever we cough or we sneeze, we have to cover our mouth. So with tissue, if we use tissue, so after using the tissue, we have to throw it properly in the trash can, and then we have to perform hand hygiene. So it's very important that you perform hand hygiene whenever you have contact with respiratory secretions. So another strategy in stopping the transmission, so there are several strategies like hand hygiene, environmental hygiene, and the rational or the proper use of PPE. So hand hygiene, so ito yung sabi namin na silver lining with this pandemic, because hand hygiene, again, it's not a new practice. It's there ever since, and it's considered actually as the single most important preventive measure in transmitting any microorganism, not just only virus. So we have to, with this pandemic, the practice of hand hygiene was somehow highlighted. Okay, so still we follow the recommendation of the Department of Health to do hand washing, so ideally 20 seconds for best results. But they actually equate now the proper hand washing with soap and water with alcohol-based hand rub. Minsan kasi yun ang nagiging excuse not only by healthcare workers, before wala daw tubig or walang facilities. So with alcohol-based hand rub, it's actually considered as a good hand hygiene. So they recommend nga at least use of at least 70% alcohol. But of course, when you have visibly soiled or dirty hands, you have to perform hand washing with soap and water. So next, so another important public health measure is environmental hygiene. Sometimes this is not actually highlighted, but if we just consider again the mode of transmission of the virus, it actually has a big impact in mitigating the spread of the virus. So when we say environmental hygiene, so it includes proper cleaning, so with soap and water of the surfaces, and disinfecting. So when we pertain to disinfecting, it uses disinfectant or chemicals that will actually kill the organism, or in this case, the virus. So this slide just only shows that SARS-CoV-2, so several studies showed that the virus can remain viable. Okay, so it's established mode of transmission nga eh. So they can remain viable on these several surfaces, but whenever we perform proper cleaning and disinfecting, even if these viruses are on these surfaces, we can still prevent the transmission or spread of the virus. Next, another public health measure. So we have this use of face masks and face shields. So since the early part of the pandemic, there was what we call as quote-unquote universal masking, di ba? So whenever we go out of our homes, we have to wear masks. But as mentioned by Ma'am Issa a while ago, it's not just wearing masks, but we have to properly wear the mask and also rational use of face masks, because certain situations might require different type of mask as compared to other. For example, in the community, so to date, okay, in our country, still the recommendation in the community is just the use of cloth mask, okay, as a form of mask, as compared to those healthcare workers, for example, healthcare workers working in PGH, taking care of critically ill COVID-19 patients, then they are at higher risk for getting the virus because of the situation. Then a normal cloth mask might not be sufficient, and they might need a higher grade of mask such as N95. So we have to consider the situation and take note of the appropriate mask that is needed for that particular instance. So aside from rational use of face masks, we have to properly wear the mask. So they say Filipinos are one of the most obedient daw in wearing mask. But sometimes, minsan nakakalimutan, gumagamit lang ng mask, pero hindi tama. But we want to emphasize here that it's not just wearing mask, but it's proper way of wearing mask. So, what's the proper way of wearing mask ba? So, it should cover both your nose and your mouth. Hindi yung minsan nakita po natin yung mask under the chin or ginagawang headband, because again, the rationale is on the mode of transmission. So you have to cover your nose and your mouth because those are the portals of entry of the virus. And then the mask should fit snugly against the sides of your face and don't have gaps too, so as not to prevent the escape of the virus. So wearing mask is, the goal of wearing masks are mainly based on two things. So as your protection against others, and also so as not to infect other people. Okay, so yun yung two goals of wearing masks. So again, we have universal masking na, di ba? So every time we go out of the house, we have to wear masks all the time, except in certain conditions. So there are exceptions. Of course, when we eat and we drink, how can we eat or we drink if may mask, no? So eating or drinking, but take note, provided according to Department of Health, if we don't wear masks when we eat, we have to still maintain physical distancing, which is another public health measure in preventing the spread of the virus. Also, it's advised that when you do high-intensity physical activities, for example, running, sometimes it's more dangerous that you wear mask. Pwedeng wala daw mask, but again, you still maintain physical distancing. So take note, even if not wearing mask is approved or allowed, you still have to follow other public health measures. Also, wearing mask is not recommended for children less than 2 years old because of the issue of suffocation, and of course, understandably for persons who are unconscious, incapacitated, or unable to remove the mask. So another public health measures I've been mentioning a while ago, maintenance of physical distancing at all times. So the recommendation is a minimum of 1 meter. Again, it will take back to the mode of transmission of the virus, because studies show that after sneezing, medyo forceful kasi ang sneezing, even if you have respiratory droplet, it can reach farthest is around 6 meters. When coughing, 3 meters. But with normal exhaling or normal talking, the minimum extent of the respiratory droplet is around 1 meter. That's why this is the rationale why we advise maintenance of physical distancing. Okay, and this is actually backed up by several studies, because studies show that maintaining physical distancing can decrease the chance of getting the infection. So 12.8% lower when you observe 1 meter distancing, or can even lower to 2.6% chance if the distance is more than 1 meter. Okay, so lastly, one of the hottest issue, but it's only part of the a lot of public health measures. So COVID-19 vaccine. So I'll just be mentioning here because as we all know, next week, I think this is a one whole topic for COVID-19, so next week. So I'll just be mentioning here the use of COVID-19 vaccine as part of the public health measures against the disease, against the pandemic. So COVID-19 vaccines are being developed more quickly than usual as compared to other vaccines. So since we are in an extraordinary time, so we are in a pandemic, so they develop the vaccine more quickly than usual. But take note, even if some steps are streamlined, so no step down is skipped. Okay, so vaccine safety is still a top priority. And FDA actually, if the known benefits outweigh the risk, then FDA can make issuance of this EUA. I'm sure we all hear this buzzword then, emergency use authorization, or the FDA can issue this emergency use of the vaccine, okay, for the purpose of the pandemic, since we are in a pandemic, so as compared to commercial marketing of the vaccine. And CDC and ISIP actually recommended that the COVID-19 vaccine be offered in phases. So since we are in a pandemic, we have to prioritize first. So there are certain groups of population that should be prioritized to get the vaccine, but nevertheless, all, okay? So all will be given the vaccine, pero kailangan may mauna muna since hindi pa ganun karami ang vaccine na napoproduce. Okay, so to date, there are more than 200 vaccine trials ongoing all over the world, and more than 50. So actually 63 vaccines are in clinical development. So clinical meaning they are in these human trials already. And just like yesterday, the Food and Drug Administration, FDA, actually released or announced that they gave their EUA already to Pfizer. So one of the companies of the vaccine companies, Pfizer, since sila naman yung nauna kasing nag-submit. But other vaccine companies are waiting for the EUA from the FDA. So we are still waiting for the rollout, as said by Ma'am Issa, rollout of the vaccine. So the question is, hindi pa na-roll out ang vaccine, and then we have this new variant. So there are a lot of worries and concerns I see dun sa chat box. So wala pa nga yung vaccine, but will the vaccine work against the new variant? And I think Ma'am Issa mentioned this a while ago. The answer is yes, because experts calculate that the newly developed vaccine will still work against the new variants in the UK. So this was discussed a while ago. So again nga, mutation will alter only a piece of the large protein of the virus, but the vaccine will stimulate a broad immune response. So broad antibodies and even cell-mediated immunity, not only for this particular, for example, we have the mutated protein. So there are other parts of the protein or other parts of the virus wherein it can still be attacked by the vaccine. So mutations will not affect all the sites, okay? And antibodies can still neutralize and prevent the attachment or entry of the virus. So they say that it will take multiple mutations to render a vaccine useless. So a single mutation will not render the vaccine ineffective or will not render the vaccine useless. However, through time, if there will be multiple mutations, there's a possibility. So what's the message here? So we have to control the infection rate, as said by Ma'am Issa, since the infection will promote the mutation. So we don't want that to happen so that our vaccine will still be useful. So WHO says that while we still work towards rolling out a safe, effective vaccine, we still have to continue the essential public health actions to suppress the transmission and reduce mortality. So again, what can we do? So it's still the same. We still have the same protocols, health protocols, hand washing, physical distancing, and wearing masks. And as said by Ma'am Issa, different strain, but pareho pa rin ang precautionary measures. So they say nga during this time, we should have this universal pandemic precaution, assume that all, including you, may be infected, and we have to act accordingly. So we have to avoid, we know the risk factors, the 3 C's, closed spaces, crowded places, close contact settings, and we should not support super spreaders. So parties, unfortunately, hindi pa rin pwede, and mass gatherings, we have to limit, and then sick personnel coming to work. So again, we have these minimum public health measures. We should not be afraid. We should stay calm, keep calm. But I want to add here, yes, we have these minimum public health measures, but with the advent of the new variant, I think what's important here is the stricter observance of minimum public health measures. Kasi yun nga, no, medyo we are nearing our anniversary of the pandemic, and many people are really getting tired of following these public health measures. But they say this is not the right time to get tired, and actually we have to have stricter observance pa nga of minimum public health measures. So we still have physical distancing, it's still the same, so avoid contact, so kung makakabate, so we have other ways of greeting, di ba, for Filipinos, like wave, nod, or bow. And then we have to follow this respiratory or cough etiquette, environmental hygiene. I've emphasized a while ago the role of environmental hygiene in mitigating the spread of the virus. And of course, wearing masks. And in addition to masks, we have this face shield. And again, sabi nga natin, keep calm. So we have this pandemic, yes, we have all these worries, but we have all of these several public health measures that we can do to prevent the transmission or spread of the virus. Now, I want to end my presentation with this Swiss cheese respiratory virus pandemic defense. So this came from Issa, so I borrowed this. So this slide shows that there is no single intervention which is perfect in preventing the spread of the virus. So we can see each intervention or layer has imperfections. For example, when you just follow physical distancing, so there are still possibilities that you can get the virus. Or when you just follow wearing masks or performing hand hygiene, there are still possibilities that you will get the virus, but multiple layers. So if we practice physical distancing, wearing of masks, avoiding touching our face, and even with the shared responsibilities coming from the support of our government, financial support, then quarantine isolation, and actually at the end of the spectrum is the vaccine, no? So then we will improve the success in preventing the spread of the virus. So I think this is my last slide. And thank you very much, Director.
Thank you
so
very
much.
much. Yeah, thank you very much, Dr. Eva. We learned a lot from your presentation, and we now have two panelists. We're going to, in the interest of time, we're going to ask them to go straight into their presentation, to their reaction, maybe less than 10 minutes each or 5 minutes, but they're very important for this discussion. We're bringing to you first the health unit head of the provincial COVID-19 facility of Dinagat Islands. And Dinagat Islands is on the tip of Agusan. He's a doctor to the Barrio Frontliner, Dr. JJ Garchitorena. JJ, welcome to the webinar. Please give your brief reaction to the presentation and tell us what's going on in Dinagat.
Thank you, Ma'am Susie. Thank you. So just when the vaccines against COVID-19 are already on its last phases of trial and have actually been rolled out in some countries, a new strain has been discovered. So as discussed by our speakers, the variant is said to be more transmissible than the initial one that has infected millions of people in 2020. So one of the main reasons why it has infected millions of people and caused almost 2 million deaths is that data regarding its specific pathophysiology as well as natural history is limited and still incomplete. For us health experts and specialists, we all know that the virus are expected to mutate and have variants. This is actually the science behind getting a flu shot every year. Excuse me, sorry. But for the general public, the idea of a new variant, a more transmissible and contagious version of the virus that has caused deaths, disruptions in the economy, planned activities, and has affected the daily lives of everyone is something that is difficult to comprehend, accept, and is certainly accompanied by fear, despair, and disbelief. So Dinagat Islands is one of the newest, smallest, and also the 11th poorest province in the country. We have 3 district hospitals here, but all of them are categorized as infirmaries. Patients requiring ancillary procedures and special treatment and management will have to travel for an hour or more by sea to reach Surigao City where the big hospitals are. But despite these limitations in the health system and the services, Dinagat Islands was actually one of the last provinces in the country to record a COVID-19 case. So we owe everything to the efforts of the local government units, both the provincial and the municipal LGUs, the health offices, our PHO and the MHOs, as well as the cooperation of the people. So we recorded our first confirmed case in August 2020 and our first local transmission by October. Um, by November 2020, 5 out of 7 municipalities have cases of local and community transmission already. So it was something we expected. Also, with the recent holidays, Dinagat Islands, just like the rest of the country, expects a surge in cases. So, and as was mentioned earlier, just a few days ago, the DOH has announced the first case of the UK variant in the country. So what is it for us? Like what was mentioned by Doc Issa and Doc Eva, nothing will change in the current measures in place. It should just be strengthened and observed strictly. So with mitigation, it is not just the government's or the health sector's responsibility, but also the community's responsibility to prevent the further spread of the virus. The World Health Organization and the DOH have emphasized time and again the importance of non-pharmaceutical interventions, proper hand hygiene and sanitation, use of personal protective equipment such as masks, and regular practice of physical distancing. Although information dissemination remains to be challenging, especially in the far-flung communities and the geographically isolated and disadvantaged areas, the province of Dinagat Islands, through the Provincial Information Office, has utilized social media platforms for timely updates of the situation within and outside the province. We are also shifting towards strengthening our surveillance and response. So early detection, isolation, and testing of cases is key to preventing the spread in the communities. As what has been the core principle of the province of Dinagat Islands since the start of the pandemic, our communities are our front lines. The battle is not yet over. We should just we shouldn't just be waiting for the vaccines. Mutations and variants are expected to occur and will always be there. What we need is the collective effort of everyone in order to prevent the continuous spread of the virus and to stop the increasing number of deaths. So thank you and good afternoon again, everyone.
Okay. So, thank you, Dr. JJ Garchitorena, who is our doctor to the Barrio po, from Dinagat Islands. Really, it's heartening and really, really very welcome to have a reaction from someone who is working in the front lines.
Thank you, Doc.
Finally, the last reactor po will be giving us from a patient perspective naman po. Please welcome, let's hear from the president of the Philippine Alliance of Patient Organizations, si Ma'am Maria Fatima Garcia-Lorenzo. Ma'am Girlie?
Thank you, Dr. Raymond, for inviting us. The Philippine Alliance of Patient Organizations, or PAPO, represents about 1 million patients and is a growing movement to strengthen the patient's voice. PAPO is an umbrella organization of at least 32 patient groups in the Philippines and is a member of the International Alliance of Patient Organizations, a unique global alliance of national, regional, and international groups representing patients. Our mission is to help build people-centered healthcare in the country so that the healthcare system is designed and delivered to answer the needs of patients. In the Philippines, we are currently advocating changes in 3 areas: respect for patients' rights, universal health coverage, and patient participation in health policy making. The presentations of Dr. Eva Rojas and Dr. Marisa Alejandria highlighted the importance of allotting more funding in research, science, and technology. Dr. Eva spoke about safety protocols on physical distancing, use of masks, face shields, and avoiding crowded places, which are all based on evidence on how the virus is transmitted. We need this kind of evidence-based information so we will not rely on news found in social media. Dr. Marisa thoroughly explained clinical COVID variants. I wish again to reiterate the importance of putting more funds for science and technology, especially to support her suggestions on how to move forward, namely National COVID Registry, epidemiologic surveillance, and genomic biosurveillance. Dr. Eva reminded us not to put down our guard or be complacent and continue to be mindful about safety protocols. Patients need to learn from medical experts like Dr. Eva and Dr. Marisa, so research findings are explained in layman's language to help increase patients and the public's compliance to safety protocols. We commend the Department of Health and Medical Societies for creating slogans and infographics in the vernacular for the public to understand safety measures and help stop the spread of the virus. We in PAPO use these communication collaterals to remind patients on how they can protect themselves and others from being infected by the virus. We also hold webinars and invite medical experts. So we hope we can invite Dr. Eva and Dr. Marisa too to provide patients and the public a better understanding about topics related to the pandemic. If we will be asked if we are afraid of the mutations, yes, the answer is yes. When the news broke out, the COVID-19 UK variant is now in the country, the first reaction among patient leaders was, what do we do now? This is a sentiment born from having to navigate a fragmented and broken down health system. There is fear among patient leaders of another surge, and we worry about the health system's capacity to address the increased cases of COVID-19. Why do we say this? We are close to a year living with a pandemic, but we still don't see a comprehensive and efficient testing, contact tracing, and quarantine process in communities. We had hoped government prioritized equitable and affordable access to testing, as well as adequate quarantine areas. Instead, national government relied mostly on local chief executives to address the pandemic. This gave us all the more reason to push for the immediate implementation of the Universal Healthcare Law. PhilHealth's anomalies, however, further delayed UHC's implementation, which again dashed our hopes for an improved health system in the near future. On the issue of vaccines, PAPO, together with Citizen Watch and Health Justice, released a joint statement yesterday calling on government to accelerate the nationwide deployment of safe and effective COVID-19 vaccines duly approved by the FDA. We also called for a fair and equitable prioritization plan where the rich and powerful do not get early access to the vaccines because of their socio-economic status. Most countries agree that frontline health workers and the elderly need to be prioritized, but we note with concern that persons with comorbidities have not been called out specifically. We know that the burden of NCDs is high in our country, and not including people with comorbidities might result in unfavorable outcomes for this vulnerable population. Also crucial is an extensive information campaign to address the dangerous misconceptions that are causing fears of vaccines to the public. This baseless perception can potentially delay the deployment of vaccines and can cause more infections and deaths and derail our country's economic recovery. And we called on the government to put patients at the center of the vaccination program by including the community voice and feedback to test ideas and improve the program. Participation of patient groups will ensure a broader and more constructive stakeholder consultation. We believe now more than ever, we need a whole of society and whole of community approach to tackle this pandemic. Thank you. Over to you, Dr. Raymond.
Thank you very much. Thank you very much, Girly, for that, for your views and sharing with us the how the patients see the situation. I'd like to call everyone back now for our panel discussion. So may I ask Dr. Rojas, Evalyn Rojas, and Dr. Issa to open their cameras. JJ, please open your videos. And we'll have a brief discussion in the interest of time, we may not be able to have a very long discussion, but we would really want to hear your views on some of the questions that are being asked. So let me just fire off the first question, which is the title of our webinar. And so the question is, are you afraid? Are you afraid of the mutations and variants? And I think so the question would be, what is your advice to the people who are watching us now? Dapat ba silang matakot? Should they be afraid? We'll start with Issa. Issa, go ahead.
They should not be afraid. As I've stated, no, the same measures apply. No, it's still effective. Yung face mask, face shield, distancing. So there's really no reason for us to panic or be fearful of this variants, because it's really part, no, of the evolution of viruses. So they will have variants, and again, and these are being monitored, no. Siguro, I think the fear is because it's new, no. Kasi yung flu, di ba, it mutates. But are we afraid? We're not, no. Okay. So all viruses. This one, it's really because it's new, but we need to really empower ourselves, no, to get that fear out. Otherwise, we will not be able to really go back to what the better normal or it is, no, to do our activities. Kaya, yun na, our message is still the same precautionary measures apply, whether there is a variant or not.
Thank you. Eva, how would you like to answer that question, or what's your advice to our audience?
Yes, Doc Susie. So totally agree with Ma'am Issa. So I think being afraid is a normal reaction whenever we have new information, and if we have unverified information. That's why very important, coming from the public health perspective, proper health education of people. So we have to be informed properly so that we'll know, is this should we really be afraid of this? So this is answered with this somehow webinar with information dissemination, that we should not be afraid, because we have all of these public health measures that we can do actually to prevent the spread of the virus. And then we have, in addition to that, we have the upcoming vaccine. So actually, we should keep calm. Di ba nga po sa last slide? Keep calm, do not panic, because it will not do anything good. And if we just follow these public health measures, then we can still have a good fight against this COVID-19 virus.
Thank you. Dr. JJ.
Just to add lang siguro to what Doc Issa and Doc Eva said. So I think what we really need is yung discipline. We really need to incorporate the new normal, which is not really new, in order to combat this virus. Actually, if ma-practice lang natin ng maayos itong mga public health measures, the rest of the diseases will follow, no? Mape-prevent din natin yung tuberculosis, other infectious diseases na present pa rin, na mas dapat nga natin kinatatakutan kasi for several years hindi umaayos yung ating health status. So I think parang there's no place for us to be afraid. What we really need is to prepare and to discipline ourselves in order to fight this disease.
Thank you very much. Girly.
Yes, actually, I like the Dr. Eva's last slide. We have our personal responsibilities and we have shared responsibilities. So I think for us, for the patients, for the public to calm down, we need to be able to approach this in a more systemic approach. So all of society, all of community, we should really do this together. Yun lang po. Thank you.
Okay, thank you very much. Raymond, would you want to pick up one or two questions from either the Q&A or from the YouTube channel?
Okay. Thank you, Dr. Susie, and thank you for those messages from our panelists po, no? We have a total of 50 questions. 24 of them have already been answered. But we'd like to start with the most upvoted po in terms of the questions. And I'd like to take this opportunity for this question from Patrick Ko. There have been some reports that the use of COVID-19 convalescent plasma outside clinical trials may be contributing to the emergence of the SARS-CoV-2 mutations, including the UK and the South Africa variants. Would you care to give maybe your insights, or if you have evidence, maybe you could cite those evidence po regarding this finding, and will this be a reason to stop the use of convalescent plasma for the treatment of COVID-19? Maybe we could hear from Director Issa po.
Okay. Thank you, Patrick, for the question. Yes, it's being studied, no? I don't have the references now with regards to the impact of convalescent plasma, but it's one of the therapeutic agents, no, aside from monoclonal antibodies that are being discussed as possibly uh, being affected, no, by the variant. So we need to really review uh, and do research on it.
Okay. So Raymond, let's go to your poll questions, and then do a quick evaluation, and then we're going to ask for last messages from our panel. Go ahead, Raymond.
Okay. Thank you, Dr. Susie. Okay, I am not seeing the one that I'm supposed to see. But for those who are still in the webinar, well, please take time to provide feedback po for our panel speakers. I'll just read off this very, very short assessment of our panelists. And if you could be so kind as to answer them. Number one, our panelists demonstrated thorough knowledge of the topic. Number two, the panelists were well prepared and organized. Number three, the panelists spoke clearly and audibly. Number four, the panelists used appropriate language with technical medical jargons explained. And number five, I learned through the panelists who contributed to new perspectives and knowledge on managing various key COVID-19 health issues. So I'm seeing a whole lot of our attendees. We are still at a little less than 1,300 attendees po here in the Zoom webinar. Maraming salamat po sa pag-stay on for this webinar. While our attendees are answering, maybe we could get our final messages, Dr. Susie, from our speakers po.
Thank you very much, Raymond. So, okay, so let's start with Girly. What is your parting message for our audience?
Yes, for the public and the patients, we can do this. Do not be afraid, but then we have to speak up. We have to call out if there's something wrong so that we can be part of the change of the health system. Thank you.
Thank you very much. Dr. JJ, all the way from Dinagat Islands, please.
Self-discipline, correct information. These are key to really defeating this pandemic. So I hope everyone was able to get something from our talk, from our webinar this afternoon. So thank you very much.
Thank you very much. Dr. Eva.
So COVID-19, this pandemic is considered as a public health emergency. And when we talk of public health, so we have to collaborate with other people. It's not just our own responsibility. We have shared responsibility, because when we do it together, then we can be able to fight this battle.
Great. Thank you so much. Issa.
Okay. Wag po tayong matakot. Keep calm and let us work together in solidarity in this fight against the pandemic. So, gaya ng nasabi ni na JJ, so each ng lahat, no, each one of us have a responsibility to ourselves, to our family and the community. yung pag-alaga sa ating sarili, pagsunod sa mga precautionary measures, ay pinapakita natin na mahal natin hindi lang ating sarili, kundi ang ating komunidad at ang bayan.
Thank you very much, Dr. Issa, Alejandria. We're gonna have Raymond, did you want to go to the poll questions or we're okay with that?
Well, a lot of them, actually all of them are opinions naman po, Dr. Susie.
Okay. So we'll go now to the synthesis, summary, and our closing remarks by none other than the Chancellor of UP Manila, Dr. Carmencita Padilla. So, Menchit, please go ahead with our closing.
Okay, so hold on. I really appreciate the start of the session this year because Dr. Susie said, let us start the year with hope. And if you have the information, then you will not be afraid. And that is the purpose of our webinar series. Are you afraid of COVID-19 mutations and variants, a public health perspective? Dr. June Belisario, Dean of the College of Public Health and the Center Director of Semeo Tropman Regional Center, actually had two clear messages for us. One is an appreciation of the efforts to better understand COVID-19, its mutations and variants. And he said, there is unfinished business, probably more important and more prevalent than COVID, tuberculosis, HIV, neglected diseases, and non-communicable diseases. Professor Issa Alejandria of the College of Medicine actually had a very succinct but comprehensive review of COVID-19. He gave us a quick background of the world. He said 90 million are now globally affected with 2 million deaths with the case fatality rate of 2.2. Whereas in the Philippines, we have 42,000 cases with 2% case fatality rate. And the graph that she showed, showing the beginning of a plateau and with the efforts of government to observe a possible surge is, I think, a message to us that government is actually watching on what will be the effect of the holidays and the other events in the country. Now, the quick review on the virus helps us understand the mutation and the variant. So as Professor Issa said, it is a family. Coronavirus is a family. It's similar to SARS, and that's why it has the name SARS. SARS-CoV-2 is a little bit different, and COVID-19 is the disease. Professor Issa said for the virus to spread, they have to replicate. Replicate means multiplying inside the body. And of course, we all know that it started in Wuhan. But what is important now in relation to the topic of mutations and variants is that when a coronavirus replicates, it really copies the original genome. And as Professor Issa said, the genome is is whatever is contained in the coronavirus. And in the process of copying, errors can happen. And the errors are called mutations. Mutations are mistakes, or simply said, as Professor Issa said, the change can even be a single letter. Now, she actually presented a very important information. There are thousands of mutations that are happening to our COVID-19, but there are two kinds of mutations, the silent mutations and the non-silent mutations. The silent mutations means there is no change in the amino acid or protein. It is the non-silent mutation that we are actually watching because the change in the letter will mean a change in the amino acid and the protein. So in other words, the silent mutations may have no impact on the virus, in the virus properties. So what is important now is for the scientists, the researchers, to tell us what are these non-silent mutations. And as Professor Issa said, a variant is a strain when it has a demonstrable different phenotype. So why do mutations happen? So this is beautifully explained by Professor Issa because she said that viruses really have mutations. That is part of virus evolution. The process of virus evolution is actually important. It's either it's for the better because that means it can better adapt, or it can mean a new problem, and that means we may have problems in terms of the cases in the country. So just imagine that we have thousands of mutations, and so far the mutations that we're watching is the spike protein. I recommend that you watch again her replay, because she has beautifully explained the importance of the location of the mutation, and that is what our researchers are actually talking about. She talked about the common mutations, and I'm not going to talk about that. But I think what is important to remember for us in the audience is that what are the implications when we have a possible non-silent mutation or an emerging variant? And Professor Issa said, when you have an emerging variant, and that's what we have to listen when we are watching and listening to the news, it may mean an ability to spread more quickly in people, number one. Number two, an ability to cause either milder or more disease. So it's not always severe, it can be milder. Number three is ability to evade detection by a specific diagnostic test. Number four, decreased susceptibility to therapeutic agents. Number five, ability to evade natural or vaccine-induced immunity. And number six is the current vaccine designed to target whole protein, so that it's expected to be effective in our cases. So an understanding, this is a very simple understanding when we hear a new variant coming into the Philippines, that it's carefully studied by our researchers and our clinicians to find if it has an effect on us, the people. Now, being a researcher, I really liked what Professor Issa did. No? She gave us food for thought for the researchers. I will not go into details, but she said that we need more studies to talk about the mechanisms of the new variants. We have to understand the in vitro detection of the variant resistance. We have to understand the resistance to vaccines. We have to use AI, and this is the part that's very important, linking surveillance and genomic data, and that we have to continue our surveillance using genomic data, because it is connected to our vaccine. So for our audience, I think it's very important to understand that there is so much that we don't know yet about this, about COVID-19, and there is room for knowledge to come in so that we can help our country, our people here in the Philippines. Now, moving forward, definitely the registry, the surveillance, and the genomic surveillance. Let me move on to Dr. Eva Rojas, who actually further emphasized that there's really nothing new. The main mode of transmission is the respiratory droplets. So which means if you have doing everything for whatever you're doing for the past couple of months, it's the same. She briefly mentioned about the airborne transmission, but it is actually only for those doing the procedures. I'd like you to remember the 3 C's, and I think and many in the audience actually know this. The thing to remember is that we should avoid closed spaces, the crowded conditions, and that we have to close our cases so that we can avoid the further transmission. In the hierarchy of controls, because you understand that there are several here coming from the hospital, the inverted triangle that was presented by Dr. Eva is very important for all of us, because you can see that at the top, actually, she talks about elimination, which is very difficult, substitutions, controls, administrative controls, but at the bottom, but equally important to those attending this webinar, is that the use of the PPE. Dr. Eva ends with the Swiss cheese respiratory virus pandemic defense, wherein you've got the cheese with a lot of holes, and she tells us that there is no single intervention that's really perfect to prevent to go into prevention to avoid the spread of the disease. We had 2 reactors today, and Dr. J.J. Garchitorena, who is a doctor to the Barrio in Dinagat Islands, one of the poorest communities in the country, shared how difficult it is actually to be in a very poor community, but just the same, in anticipation of the arrival of the virus, they have prepared. They appreciated that the government actually prepared them, but JJ, actually Dr. JJ explained that she put the credit also to the community's cooperation, because the success of the prevention of the spread is not only a government effort but also needs the cooperation of the community. Indeed, for a place that's so distant from the city, information dissemination is a challenge. And this is one time when social media actually has been most useful for their cases. So as Dr. Gigi said, the battle is not over. We should not just be waiting for the vaccines, but collectively we will actually be able to work on this to fight this COVID-19. Dr. Gurley, our last reactor is Dr. Gurley Lorenzo, who is actually the patient's voice, because she represents 32 patient groups in the Philippines, and now their group is now part of a global alliance. I think it's very important that we have a representative of the patient in the panel, because she clearly stated that we need to build a people-centered program so that everybody will understand that we have to respect patients' rights and that they have to participate in policy making. She was asked, she appreciated actually all the collaterals being prepared by all of the communities to make sure that the proper information is given. And I mean, this is a message for all of us, because when she said, what is my answer to the question, am I afraid? The answer is yes. And it's because of the sentiment of a fragmented health systems, because they want an assurance that there is an equitable access, not only for testing and quarantine, but when the vaccine arrives. The final messages are really food for thought for all of us. Uh, Let me just summarize the messages. Do not be afraid. All public health measures are the same. No reason to panic. This is all part of the evolution of the virus, according to Dr. Issa. Proper health education is critical, so we will not be afraid. If public health measures are in place, we can address the other public health measures. And at the end, it is self-discipline, correct information, the spirit of collaboration, doing it together. And as a final word again from Dr. Issa, wag po kayong matakot. So good afternoon, and thank you for joining the webinar today.
Thank you very much. That's our Chancellor of UP Manila, Dr. Menchit Padilla. And indeed, I think we all know this. When you're afraid, you won't be able to think. So let's not be afraid. No, we have the information in front of us. There are things we can do. There are things we can do throughout these very dynamic changes that are happening during the pandemic. All right. So next week, naku, don't miss next week, huh? And please bring people to come to the webinar. We're going to have Dr. Eric Domingo, the head of the Food and Drug Administration, and he's going to talk about the vaccines. So next Friday, for those of you who are teaching, those of you in the hospitals, invite your students. We want the young people to be involved in this, because really information is power, and we hope in our small way, our group here at the University of the Philippines is able to give you information so that we can all think and we can all solve the problems that are in front of us. So over to you, Raymond.
Thank you so much for that, again, very wonderful and comprehensive recapitulation of our messages po. And thank you really for all of our esteemed panel of speakers po. Maraming salamat. As mentioned by Dr. Susie, please tune in for our next webinar. Ito naman po ay patungkol sa vaccines, and we hope to be able to get, if you have questions, please prepare them. FDA Director General Eric Domingo has already confirmed his attendance. We have a very surprise guest po for our opening remarks. So please stay tuned. Nabantayan niyo po ang ating mga poster po that will show kung sino po ang ating opening remarks speaker for next week. So maraming salamat po. Please continue to join us in this learning journey for this webinar series We hope that as we move along, we are able to better understand how we could fight COVID-19 and how we could stop COVID deaths. So, on behalf of the Stop COVID Deaths webinar series team, I'm Dr. Raymond Francis Sarmiento. Keep safe, keep healthy, and see you online.
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer one more time. I know you long for home, but I am here, you're not alone. I'll stay with you until the coast is clear. The others pain before my fears, the others laughs before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Just look into my eyes and say his name to realize it's fine to be afraid. Just hold on to the word he gave. This time will come to pass, 'cause this salvation's made to last. He'll carry you to see the break of day. The others pain before my fears, the others laughs before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. The others pain before my fears, the others laughs before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The others pain before my fears, I'm pushing on despite the tears. Please take us through another day. Just hold my hand, and I will hold the line. I will hold the